Hello everyone, my name is Radha. I did my topic for this week on sickle cell disease. So for the disease process, sickle cell disease is an inherited blood disorder that follows an autosomal recessive pattern. This means that both the female and the male genders are affected equally, but both parents must also be carriers of the genetic mutation in order for the child to be affected, even if they are asymptomatic. When each of the parents carries a single sickle cell trait gene mutation, according to the pedigree chart, there will be a 25% chance that sickle cell disease will develop in their offspring, a 25% chance of having an unaffected child, and a 50% chance that the child will inherit the genetic mutation as an asymptomatic carrier. A person who possesses the diseased gene is phenotypically unaffected and generally healthy. This individual is said to be a carrier of the disease. Although the person is only a carrier of the gene, they will have an increased chance of having an offspring with sickle cell disease if they reproduce with another individual who is also a carrier of the gene. This blood disorder is marked by flawed hemoglobin and has a very distinct and identifiable shape. Normally, each of the red blood cells is densely packed with hemoglobin proteins. Red blood cells are smooth, disc-shaped, and flexible, like donuts without holes. Due to their composition, red blood cells can move through the blood vessels easily. On the other hand, the red blood cells with sickle cell hemoglobin are stiff and sticky. When they are in low oxygen state, they change in shape to form into a shape of a sickle. When there are many hemoglobin sickle cell molecules present within a cell, they clump together and form long chains. This process is called polymerization. These cells, due to their thickness and crescent-like shape, stick together and cannot easily move through the blood vessels. As a result, this blocks small blood vessels as well as blocking the movement of any healthy, normal oxygen-carrying blood. Ultimately, this blood disorder interferes with the delivery of oxygen to the tissues, leading to the associated symptoms of complications of sickle cell. Normally, healthy red blood cells live up to 120 days, whereas sickle cells are short-lived as they only survive for 10 to 20 days. Furthermore, the spleen destroys the sickle cells due to their shape and stiffness. The spleen also helps filter the body's blood for any infections. However, with sickle cell disease, the patient's red blood cells get clumped together in the spleen's filter, potentially damaging the spleen. With more sickle red blood cells and fewer healthy red blood cells available in the circulation system, along with a damaged spleen, the individual can become chronically anemic while being at a higher risk for infections. For pathophysiology, the specific genetic mutation that causes sickle hemoglobin involves the substitution of a single amino acid, thymine, for adenine, which is located on the 6th codon of the genetic sequence. This genetic alteration is responsible for the change of the physical properties of the hemoglobin in cell. It changes their shape to the characteristic sickle shape, as well as their physical properties, such as solubility and stability. It is these properties of the sickle cell that accounts for the changes in its function and result in common complications of the disease, such as multi-organ hypoxia. In combination with other abnormal beta alleles, when red blood cells that contain sickle hemoglobin is exposed to a deoxygenated environment, they undergo polymerization and become rigid. The sickle hemoglobin polymerization and red blood sickling are the root causes of the pathology in sickle cell disease. The rigidness of the red blood cells are the cause of hemolysis, while increased density affect the blood flow as well as the endothelial vessel wall integrity. The dense rigidness of the red blood cells leads to vasoocclusion. tissue ischemia, infraction, as well as hemolysis. The consequences of hemolysis of red blood cells is a complex cascade of events which includes hemolysis-linked nitric oxide dysregulation, nitric oxide consumption, and endothelial dysfunction, which leads to certain complications such as pulmonary hypertension, like ulceration, stroke, and bradyism. To the increased level of hemolysis, sickle red blood cells are short-lived in comparison to normal red blood cells. They only survive for approximately 10 to 20 days. Typically, healthy hemoglobin is capable of rearranging itself into different conformation during deoxygenation in the vascular system. They do so by binding with carbon dioxide molecules, which then they revert back to normal when released. However, in contrast to healthy hemoglobin, sickle hemoglobin is incapable of rearranging itself into different conformation, thus becomes significantly more insoluble, increasing the polymer formation within the blood and its overall viscosity, leading to many life-threatening complications of sickle cell disease. So what are the risk factors? Individuals with a family history of sickle cell disease are at an increased risk for inheriting the disease. In the United States, this disease mainly affects people of African American descent. Factors that may trigger a crisis in people who are already diagnosed with sickle cell disease include swimming in cold water, being in cold weather, high altitudes, and partaking in heavy physical labor. Those individuals should avoid infections by getting regular dental exams and avoiding those who are sick. Additionally, these individuals should wash their hands frequently and get annual flu shot. So what are the major signs and factors of sickle cell disease? The typical clinical representation of sickle cell disease are patients with a chief complaint of chronic hemolytic anemia and vaso-occlusive related crisis. The change in shape and stiffness of the sickle cell red blood cells can have an effect on any or all of the major organs that are caused by hemolytic anemia and vaso-occlusive crisis. Due to the abnormal function of the sickle cells, in addition to its inability to flow through small blood vessels, can cause damage to one's heart, kidneys, liver, gallbladder, joints, bones, and eye can be suffered also. The inability of proper blood flow within the vascular system causes pain crisis or sickle crisis. The pain can occur anywhere in the body where vaso-occlusion is occurring, but most often the pain is felt in the chest, arms, and legs. Infants as well as young children may have painful swelling of their fingers and toes. Additionally, interruptions in the blood flow may also lead to multiple tissue death. Normally, healthy red blood cells live up to 120 days, whereas sickle cell are short-lived and can only survive for approximately 10 to 20 days. However, in sickle cell disease, the body has trouble producing enough new red blood cells to sustain the body's demand in order to keep up with how fast the cells are being destroyed. As a result, there are fewer red blood cells available in the body, leading to anemia. Signs and symptoms of severe anemia include shortness of breath, fatigue, and dizziness. Clinically, approximately half of the individuals with homozygous sickle cell disease experience vaso-occlusive crisis. However, the frequency of experienced sickle cell crisis is extremely variable. For example, some patients may have as many as 6 or more crisis episodes annually, whereas other individuals may have one episode or none at all. Pain is also the most common clinical manifestation of sickle cell disease, where it is caused by vaso-occlusive crisis. It is one of the most distinguishing clinical features of sickle cell disease in individuals within inpatient hospital settings. These individuals will have complaints of acute and chronic pain, mainly in their bones and joints. The representation of bone pain is primarily due to, like ulcers, bone marrow infractions, and hand and foot syndrome, which represents as bilateral painful and swollen hands and feet in children. For some individuals, chronic low-level pain may be the only symptom. This blood disorder can further lead to many other medical problems. Patients with sickle cell disease are vulnerable to infections, pulmonary hypertension, like ulcers, bone damage, gallstones, kidney and liver damage, and ophthalmic damages, including ptosis, retinal vascular changes, and proliferative retinitis. Aplastic crisis is one of the serious complications of sickle cell disease due to infections with paravirus B19. Another serious hallmark complication is the triggers of vaso-occlusive crisis, which includes hypoxemia. It can be caused by acute chest syndrome or respiratory complications. This occurs when the sickle cell clump together, blocking the flow of oxygen as well as other healthy blood cells from entering the small vessels within the lungs. This can be life-threatening to the individual, as it is often sudden when the body is under stress from fever, potential infections, or dehydration. In acute syndrome, adults present with dyspnea, with severe chest pain, joint and bone pain, and a violent cough. Young children present with leukocytosis, pulmonary infiltrates in the upper lobes, fever, tachypnea, cough, fever, and chest pain. Children may also have delayed sexual maturation and be underweight. Cholelithiasis is also common in children. Another symptom of sickle cell disease is splenic sequestration, which is characterized by the onset of life-threatening anemia with rapid enlargement of the spleen due to sickle cells, pooling and from the increase in blood volume. Patients have a high erythrocyte count. If splenic sequestration is not clinically recognized and treated promptly, it can become detrimental to the individual as it causes sudden drop in their level of hemoglobin. After multiple occurrences of splenic sequestration, the spleen eventually becomes scarred and consequently gets permanently damaged. Without a properly functioning spleen, there's a major concern for those individuals as they are at a greater risk for infection. The risk is even higher in younger population as the infection can be a major cause of death in children 5 years or younger. Another sudden or severe complication for people diagnosed with sickle cell disease is their increased risk for having a stroke. Due to the characteristics of sickle cell, it will interrupt the blood flow and decrease the oxygen supply that is supplying the brain as well as the heart, causing a major blood vessel block. As a result, one suffers from severe brain damage. If an individual suffers from a stroke due to a sickle cell anemia, they are more likely to suffer from a second and even a third stroke. Lastly, due to a sickle cell short lifespan, the liver is unable to filter all of the blood cells as quickly as they are dying. Consequently, bilirubin occurs from all the buildup of these broken down cells in the system, causing jaundice. Jaundice is a common sign and symptom for a patient diagnosed with sickle cell disease. So how do we diagnose, what are the diagnostic tests for sickle cell disease? It usually manifests early on in childhood. For the first 6 months of one's life, infants are protected largely by elevated levels of fetal hemoglobin. Therefore, screening babies at birth is currently mandatory in the United States. For families with known risk for sickle cell, prenatal and DNA testing can be easily obtained via coronavirus sampling at 10 to 12-week gestation. The mother's amniotic fluid can also be tested as early as 14 weeks as part of DNA screening weeks to confirm a diagnosis of the sickle cell genotype. Many states now routinely screen all of the newborns for sickle cell. This is done as soon as possible so that newborn's treatment can begin as soon as possible while they are still protected by fetal hemoglobin. Evaluating an individual, reviewing their complete medical as well as their familiar history, while also focusing on their physical exam, is necessary in the diagnosis and treatment of sickle cell disease. To aid in the diagnosis of sickle cell disease in patients with a potential family history of the disease or the trait, providers can screen for serum electrolytes, hemoglobin solubility testing, peripheral blood smear, preliminary function test with other labs including CBC with differential rectolite count, kidney function including creatinine, BUN, and urinalysis. Understanding the effects of sickle cell disease. One can have on the liver. HIPTA biliary function tests should be ordered, which include the levels of ALT, AST, and fractional bilirubin. Patients with suggestive signs and symptoms of the disorder or its complications, such as unexplained bone pain, unexplained hematuria, poor growth, and patients with African ancestry with known normocytic anemia should prompt consideration for sickle cell treatment. They will require laboratory testing for hemolytic anemia and examinations of red blood cells via dry stain smears. Another test to conduct for sickle cell disease is hemoglobin electrophoresis. Hemoglobin electrophoresis is a confirmatory test that is used to detect any presence of homozygous sickle cell hemoglobin in an individual. Hemoglobin electrophoresis uses a small amount of blood of patient's blood sample to detect any presence of sickle cell hemoglobin and determine if, in fact, this patient is a carrier or has associated diseases with sickle cell genes. Early diagnosis and proper treatment of the sickle cell disease can reduce the risk and complications and improve one's quality of life. That concludes the end of my presentation. I hope you enjoyed it and learned. Thank you so much.